Now, what is the relationship that you've seen between obesity and depression?
Well, basically, I've looked at a lot of studies, and many of these studies have concluded that individuals that are living with obesity have a higher prevalence and or a higher probability of having depression. Now, many of these studies in the conclusions, it was noted that the contributors to these individuals that were studied living with obesity, having depression, were many of the comorbidities associated with obesity, such as joint pain, the forms of arthritis, heart disease, diabetes. And it was also noted that many of the individuals that were living with obesity, with depression, that were studied, had a higher perception of negative social interactions. But I can positively say that in our clinic, many of our patients that are living with obesity, the ones that we've been successful to help them lose a great deal of weight, have come back and reported to us that they have a happier disposition.
So, what is the medical community's position on the recent controversy involving the question of weight loss medications causing an increased rate of suicidal ideation?
Well, the protocol for the medical community, I proudly say that it's unchanged. Safety is our number one priority. Now, many of these medications that are used to help a person get to a healthier weight, they're studied through very detailed research. And it's very well documented that the medicine has a very high safety protocol, very low risk, but also very, very effective. But we do still follow protocols, meaning that we monitor our patients every visit to make sure they don't have any signs or symptoms of depression or suicidal ideation. If they do, we act accordingly.
So, have you prescribed any of these medications, and did you experience any of these suicidal ideations with your patients?
Well, as I said earlier, the majority of our patients that we've been very successful to help them get to a healthier weight, many of these patients, they've come back and they've expressed a happier disposition. Many patients say, Doc, I lost, 30, 40, 50 pounds and I feel better about myself and I'm happier. These are my personal observations. But I have had some patients that had unrealistic expectations because of the hype associated with the medicine. Many people want to lose just unrealistic weight in the first month, and sometimes they'd be a little disappointed. Now, if an individual did have depression or anxiety pre-existing, then they would be at a higher probability of having suicidal ideation, but I haven't seen that in our practice, but we will, continue to monitor our patients for safety.
Thank you so much, Dr. Quinn.